Now, unfortunately, that message is not being received with open arms by some in the community. One instance, it's led to threats against a doctor in the Treasure Valley. Our Tristan Lewis is on the story for us tonight. Tristan, tell us about this. This is weird.
Yeah, so Mark, Dr. Ashley Carvalho was working out of an ICU in Boise when a COVID patient's family wanted her to use different forms of treatment, including ivermectin. When she refused and explained why she can't prescribe the medication they wanted, it led to a confrontation that actually made Carvalho call for security. She says she isn't the only healthcare worker experiencing these tense and sometimes fearful moments.
It's really disheartening. We're not doing anything in our own interest. We're doing everything in the patient's interest.
It was a rough go-around for Dr. Ashley Carvalho while working in a Boise ICU a few weeks ago. Within just 2 weeks, she saw 14 patients die from COVID-19. One night in particular was more difficult than others.
I think I was 3 hours into my night shift and had 2 patients in their 30s and 40s die of COVID, of complications from COVID.
Both were unvaccinated. Both had seemed healthy prior to their COVID diagnosis.
It's difficult how much waste of life we've been having. I've been seeing patients my age, slightly older.
Things just continue to go downhill from there. While trying to take care of an unvaccinated patient with COVID, their family members wanted her to use ivermectin and hydroxychloroquine, both of which have not been proven to treat COVID. She refused and says it led to verbal abuse from the family.
It was really difficult in the sense of the confrontation that I experienced with that family, but also it was heightened by the fact that the patient was so uncomfortable, so distressed right in that moment.
She believes the high emotions are what led to one family member telling her this.
I have lots of ways to get people to do things that I want them to do. They're all sitting in my gun safe at home.
What at that moment are you feeling? Are you really nervous for your safety?
I wasn't nervous for my safety. I was more concerned for the patient at that time because he was in such distress. He was really struggling to breathe. He was very sick, and I wasn't able to provide the care I needed to give him because of this family.
The exchange prompted Carvalho to have security remove the family and continue treating the patient. But these stories are now becoming a dime a dozen these days, from what Carvalho and other medical leaders say stems from misinformation.
It's disheartening to hear that our healthcare workers have moved from feeling like heroes to feeling at risk.
While Carvalho feels exhausted and burnt out, she continues to want to help. She hopes by sharing her story, it'll let other healthcare workers going through similar experiences know they're not alone, as well as relight some spark of compassion in the public that has gotten lost in the past year.
I feel like I want patients to know that we respect them and we're very open to conversation about this.
Carvalho says as last check, the patient is doing better. The Idaho Department of Health and Welfare says they are aware of rising concerns for the security of hospital and medical staff, and they say they've offered hospitals more support and increase in security with the help of the Idaho Office of Emergency Management. Mark?
It's getting sad and ugly when security personnel have to remove the patient's family and friends for fear of her safety. All right, Tristan, thank you.